Now, the lower is problematic from start to finish. It's problematic making the custom tray. Which was more difficult, the upper or the lower? It was the lower. What was more difficult, the bead and box? Well, you guys took that, and you took that, I call it a cheating approach, but you can call it what you want. You're documenting this, right? Good, good. In the bowl, yeah, everybody's looking for the bowl. But for the lower, honestly, his approach, if done correctly, is going to save you a lot of time and a lot of sweat and tears next year when you're working with some of these patients. But you can see how narrow and small that ridge is, right? Now, we've gone from custom tray, difficult, more difficult, to the beading and boxing, more difficult. It takes you 2 to 3 times longer to bead and box this, the way I do it, than it does this, right? So thank you, Dr. Choi. Right? Then after that, we build the rim, right? We got to build the rim. Of course, that's not too difficult. But now we have try-in. When you put this in the mouth, for all intents and purposes, it's almost going to sound like a little suction cup, depending on the patient's saliva, whether they have dry mouth, or, good saliva, bad saliva, dry mouth, wet mouth, whatever, undercuts. But this covers all of this area, and it's got all of this support, right? Look at this little thing. It's in the mouth, just sort of going like this, all over the place. So the biggest thing we can do for that patient is to stabilize this thing the best we can in function, right? Upper, lower, night and day, as far as difficulty. For us to fabricate, for them to wear. So, we've gone through the jaw relations, we've gone through the setup, we've gone through the processing. And now we're back to what we just did, right? This is a little bit different, they use a different material. But again, this is your model, right? And their custom tray. Why are the custom trays so important? Simply because, again, we are customizing this appliance for that patient. And in 90% of the cases, it's all tissue supported. So we have to do the coverage that's necessary for stability. We have to do the static impression, which is a uniform thickness of impression material, right? Without it putting any undue pressure on the tissue. Because if we put a lot of pressure on that tissue while we're making the impression, right, then we are displacing tissue. The tissue in the mouth is not that way. We want a static impression of the tissue. Now, for a lot of us, we suffered through, and I suffered through it along with you. Because you guys were getting compound all over my shirt, my thighs, my pants, and then you come over to the lab, my office, and set it all down on my desk with all of my papers, right? And I'd sit there and I'd look at my pants, and you'd continue to talk. And you got a quarter stick of compound on my thing. Anyway, why is this so important? The first impression we take is overextended. Why? Because we're using either alginate or a brown compound, and we want to overextend that impression, right? We want to capture everything, but we want to overextend it. Once we get that, then we make the custom tray. And the custom tray is where we back it off, we get a space for our compound, right? We put our stops in there so that we have, what do the stops do? They're called tissue stops. Why? Because they're in the area of tissue on the cast, right? Well, these stops stop anything if you apply enough pressure in that patient's mouth. Now you can go right to bone, right? All they do is offer some resistance. You can feel it as you're going up and doing your border move, right? So, on the cast, stabilization, in the mouth, resistance, but they won't stop. You push hard enough, and then you can perf the tissue, right? So, the next thing we do after everything is checked off and we're satisfied with the way we have backed off this tray, leaving space because we have an overextended preliminary impression. Everybody with me? Anybody 75% with me? You're awfully nice people or lying like hell. You can't be up to date on this. But anyway.
Yes, we are.
So we back that off. It's our best guesstimation, right? Now what do? We put compound on there. And we go back into the mouth. And the question was, which is a logical question if you've never done it before or heard of it before, if we put the compound on there, why are we cutting it away? Right? Which makes sense. When we're doing the compound on here, we've got our rigid pink patient, right? And we're just putting it on till it seats, and our cast is our cast, it's rigid, the compound is going to stop, right? Before we put the compound on, we cut away the wax. Remember we dropped it 3 to 4 millimeters? That was to make room for the compound. Now if the wax was our spacer for making the tray, and then our compound overlaps that area of wax that we removed, that compound is now putting pressure on the patient if we put it in that way. So again, we have to get in there with a knife, scalpel, whatever it is you use, and we have to back that tissue side compound off so that there is again room for the impression material, right? So what do we want out of the border molding? What we want is the vertical height, right? Remember, I drew a line on a lot of your compounds, and I said this is the height of contour, the highest point, right? I said when you back off that lingual aspect, leave the line, right? This is just for reference. But when you left that line, and I know I did this 1,000 times, so forgive me again, we have the patient. Got it? Over top of the patient, we have the wax shim that we put on. Over top of that wax shim, it's the custom tray. Everybody got it? Then we remove a segment of the wax for the compound. So what happens? We put the compound on where we did have that space between the custom tray and the tissue. Now we have this. We have the space except where the compound hit. Now the compound is putting pressure on the tissue. We want a static impression. So we took our knives and we scraped that compound until it again was a distance away, right? Some of you were showing me your impressions and you said, I see a pressure spot here, right? What you were seeing was your compound showing through. What that would be, and it has nothing to do with your impression, all your impressions were great for the most part, at least everyone I saw. But you identified that spot, which was a pressure spot. That in turn would be a pressure spot in the final appliance, which means the patient would have a sore spot, which means they'd be coming back to you to have that adjusted in function, okay? Last thing. Was there something else? Okay, so we have gone from the insertion of the final denture all the way back through the denture try-in, back through the mounting of the rims, which you as a dentist have worked on to customize it for that patient, to the custom trays, right? So do you have a little better grasp of the sequence from the end product back through the beginning? Okay? What is so important about border molding? If you border mold and you overextend that border molding, now you gotta remember, we had stops on this cast. On our pink patient, we couldn't overextend it. It's gonna fill that space. In the mouth, you're gonna put that compound on your tray, you're gonna put it in the mouth, you're going to grab the person's cheek like this, and you're going to roll it like that. you're gonna border mold it with the patient's musculature in the mouth. If you don't do that border molding, right, then you could be overextended with that compound. Then, from that point, you're gonna be overextended here, and then here, and then here, all the way around, you see? So that border molding, as you get started, is critical all the way around, right? If you overextend that border molding and the lab processes that case to that overextended border, right? Every time the patient talks, anything that's using their musculature in their mouth, the denture is going to spring out, right? Just spring out of their mouth. If you're underextended, it's going to fall out of their mouth. How do we make it just right? Border molding to get that perfect height. Now, if it's overextended, say you screwed up, and you can always back it off in the denture, but hopefully not. Yes, ma'am.
You said the